So, for our job analysis, we'll be analyzing a rotator cuff disease. Specifically, we'll be applying modifications to a bartender who suffers from rotator cuff disease. But before we get into that, I'll give you a brief description of what this injury is. So, what is a rotator cuff? There are four muscles whose tendons form the rotator cuff. The subscapularis muscle, which moves the arm by turning it inward or inward rotation. The supraspinatus muscle, which is responsible for elevating the arm and moving it away from the body. The infraspinatus muscle, which assists in lifting the arm during the arm outward and external rotation. And the teres minor muscle, which also helps in the outward turning of the arm. So Marianne, can you tell us a little bit about the etiology?
Yeah, of course. So for a rotator cuff disease, it can be sustained from repetitive overhead use, heavy lifting over long periods of time, and the formation of the bone spurs within the bones and surrounding the shoulder joint. So certain factors that could cause this is age. So the older you are, the risk increases that you will sustain this. Athletes, since they have repetitive arm movements, that they're at high risk, such as baseball pitchers and tennis players. Certain jobs also, employees that require repetitive arm movements, like painters, carpenters, and, as our job analysis, bartenders. Also, family history is also a factor.
Okay, well, let's go ahead and get right into our case study then.
Yeah, sounds good.
Okay.
Leticia is a 29-year-old bartender at Ben's Next Door, which is a local bar and restaurant in Washington, D.C. After a busy holiday weekend at the bar, our client went to her physician with complaints of pain throughout the day and night that interrupted her sleep, as well as weakness and reduced range of motion in her right shoulder. Through use of an MRI, Leticia was determined to have a partial rotator cuff tear. Considering 25% of the rotator cuff tendon was torn, a non-surgical treatment approach was recommended. It was recommended that Leticia rest her shoulder and limit overhead activities and avoid activities that cause pain in her shoulder. Shoulder exercise under the supervision of a rehabilitation therapist and anti-inflammatory medication use is underway. Her physician also recommended the use of a job analysis from an occupational therapist to help Leticia continue to perform at her place of work without causing further damage to her affected shoulder. This includes making modifications to her work environment and activities.
This is an example of how a bartender would make a drink for a customer.
Hi, can I please have a rum punch?
Sure.
Thank you very much.
So guys, what do you think would be appropriate modifications for her in making the drinks at the bar?
Well, I think if she has rotator cuff disease, I think one of the modifications that we can change are, instead of her reaching up high to grab a glass, she can simply reach down low on a lower shelf. That way she's not overexerting her shoulder trying to make a drink for somebody. What about you, Melissa? What do you think?
I think that she could make a drink on a lower surface instead of making it on top of the bar. It would put less stress on the shoulder.
I think that if she were to make the drink, instead of shaking it above her shoulder, that and raising her arm up high, that she could shake it a little lower so that she's reducing the angle of flexion in her shoulder.
That's good. That's good. Well, let's see if she tries these modifications. Let's see if she feels a lot better.
Yeah.
Okay?
So what are you drinking?
Oh my gosh, it's a rum punch. So good.
What do you like?
I think I'm going to have what she's having.
It was the best time.